and today I'll be discussing the correlation between children per woman, the total fertility, and the child mortality, that is, children between the ages of 0 and 5 dying per 1,000 born. As the UN reports, two-thirds of child deaths are preventable. Most of the children who die each year could be saved by low-tech, evidence-based, cost-effective measures such as vaccines, antibiotics, micronutrient supplementation, insecticide-treated bed nets, improved family care and breastfeeding practices, and oral rehydration. Therapy. Um, Furthermore, empowering women, removing financial and social barriers to accessing basic services, developing innovations that make the supply of critical services more available to the poor, and increasing local accountability of health systems are policy interventions that have allowed health systems to improve equity and reduce mortality. In 2013, the world average was 46, which is 4.6%, down from 90, which is 9.0% in 1990. The average was 6 in developed countries and 50 in developing countries. The second indicator, children per woman, is a useful indicator in identifying patterns in a population, and it varies with not only changing trends in society, but also with the empowerment of women and the increased availability of contraception throughout the years. Developed countries tend to lean towards having less children, in contrast to developing countries, which usually have more children per woman. Particularly in rural areas, through a combination of lack of contraception and the low cost but high benefits of having a child. Now, if we take a look at the chart, which is currently displaying the year 1800, we can see that perhaps surprisingly all the countries are on the same level in terms of child mortality, with just around 400 per 1,000 children born dying. Denmark currently stands at 380. Kyrgyzstan, or the Kyrgyz Republic, stands at 383, and only Malaysia stands out slightly with 436 children between the age of 0 to 5 dying out of 1,000. These large numbers are mostly caused by the lack of proper health care and emphasis on maternal health in the year 1800. If we take a look at the children per woman, then we can see that Kyrgyz Republic comes out as the winner with 6.6 children per woman. It is then followed by Malaysia with 5.5 children per woman, and last is Denmark with 4 children per woman. Now, the Denmark statistic is particularly interesting as almost 40% of these children were dying at that time before reaching the age of 5, meaning that ultimately they were having just around 2.5 surviving children per woman, which seems as a pretty low number considering that era and is almost comparable to current dates. Is barely sustaining the population. Then as we move on through the next 25 years, we can see that the only country with any real changing data is Denmark, whose children per woman count rises very slightly from 4 to 4.2. However, this is not a significant enough difference to not be counted for by regression to the mean. Child mortality, however, drops down to 352 children per 1,000 born, a significant progress. Overall, Denmark improves to approximately 2.7 surviving children per mother at that point that we went through in 1825. Yes, so right around here. Then, as we continue towards the year 1900, we can see the data in Denmark becoming more jumpy, with significant inconsistencies between the years. The general trend, though, remains a very slight growth in the fertility rate and a steady decline in the child mortality rate as medicine progresses and more unnecessary deaths are avoided. The two LEDCs joined Denmark in its journey towards more healthy children come the year 1900 when they start recording the data. However, at this point, Denmark already has a significant head start in child mortality, in that they have less children dying, and also they're already very slightly trending toward having less children. However, we can see that both the Kyrgyz Republic and Malaysia, once they start recording their data, have significant trends, particularly in 1930 and onwards. There are significant progresses being made in terms of healthcare, and all the countries uh, are continuing towards having less children dying, and also having less children in the first place, further with a move to urbanization.
Stu's coming back.
We don't know.